All right, hello. So we're going to be doing a screen on our patient consisting of a number of things. I'm going to start with the sensory screen part. Okay, so the way this is going to work is I'm just going to touch a certain part of you. It's going to feel like this. I just want you to close your eyes and tell me if you feel it, okay?
Okay.
All right, so arms out, yep. All right, close your eyes for me. Okay.
Yep. 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 Yep.
Okay. So I just tested some of the dermatomes. Now I'm going to move into the peripheral nerves. So we're going to do the exact same thing. I want you to close your eyes and tell me if you feel it, okay?
Mm-hmm.
All right. So the first one is the supraclavicular nerve.
Yep.
Okay. Now I'm going to test the axillary nerve.
Yep.
Now I'm going to test the lateral antebrachial nerve.
Mm-hmm.
Now I'm going to test the radial nerve.
Yep.
Now I'm going to test the median nerve.
Yep.
Now I'm going to test the ulnar nerve.
Mm-hmm.
Now I'm going to test the medial antebrachial cutaneous nerve.
Mm-hmm.
And I'm going to test the medial brachial cutaneous nerve.
Mm-hmm.
All right. So that should be all the sensory screening portion. For the motor screening, I'm going to test some of the myotomes. So the way this is going to work is I'm going to have you hold a certain position, and I'm going to push down on you, and I want you to just resist me, okay?
Mm-hmm.
All right. So first, I want you to hold your arms out like this. All right. I'm going to push down. I want you to resist, okay?
Mm-hmm.
Good job. We're going to come to the other side. Okay, good job. Okay, so I want you to hike your leg up like this. All right, I'm going to push down. I want you to resist me, okay?
Mm-hmm.
Good job. We're going to do the other side. Hike your leg up. Good. All right, good job. So those were some of the myotones. Now I'm going to test this coordination. What I want you to do is I'm going to, I want you to touch your finger to your nose. So I want you to come in, push it out, and then come in, push it out. All right, now in between that, I want you to go finger to nose, touch my hand, and then nose, and then out, and then same thing on the other side. So finger to nose, and nose, out. Same thing on that side. Nose, touch. All right, good job. Okay, so that is for the motor screening. Now we're going to test all of his cranial nerves. So, first thing I want you to do, I'm going to put something to your nose. I want you to tell me if you can smell it and what it smells like, okay? I want you to close your eyes, and I want you to close one nostril, all right? All right. Can you smell?
Yep. Smelled like lavender.
Okay. Can you close the other nostril? You smell what it smells like?
Mm-hmm.
Was it?
Like some cinnamon.
Okay. Good job. All right. Now I'm going to test cranial or screen cranial nerve 2. So I'm just going to shine this into your eye.
Mm-hmm.
I'm just going to check your eyes out to see if everything is functioning properly, okay? Good. It's good consensual reflexes. All right. Now I'm going to test or screen for cranial nerve 3. I'm going to move this object up and down. I want you to just follow with your eyes, okay?
Mm-hmm.
All right. Okay. Now I'm going to bring it to you. All right. Good job. Now, I am going to just touch your face a little bit. What I want you to do is just make a, just collapse your jaw for me. Yep. All right, good job. All right. Now, I'm going to just touch some parts of your head. I want you to tell me if you feel it, okay?
Mm-hmm.
All right, so close your eyes for me.
Mm-hmm. Mm-hmm. Yep. Yep.
All right, good job. Can you make a face for me? Something like this, okay? Can you blow your face out? All right, good job. Okay, so now I'm gonna put something up to your ear. I want you to tell me if you can hear it, okay?
Okay.
Can you close your eyes? All right.
Mm-hmm. Yep.
All right, good. So now, for cranial nerve 8, we're going to do a Romberg in a second, so we'll assess that later. So now we're going to, I'm going to have you say ah at different pitches. So first I just want you to say like ah in a low voice. Okay, good job. Can you say it in a higher voice? Ah. Perfect. All right, I want you to shrug your shoulders for me. All right, good job. Come down. All right. So now, can you stick your tongue out for me? Can you move it side to side? All right. And can you actually do that again? Say All right. Good job. Now, so now we're at the integumentary and cardiovascular part of the screen. For the integumentary, I would just check any areas of their skin. If they're presenting with a fall, I would just check maybe the area that they fall in. Also checking just to make sure they might not have any like red flags such as like shingles or anything that they're coming into the clinic with. For cardiovascular, I would definitely check their heart rate and blood pressure, SpO2, respiration rate, and document that. And so those are the type of screens I would do for those. After that, so I would check their balance. So, well, we're going to check the balance. So what I'm going to have you do is stand up for me. Okay. So what I want you to do is just maintain this stance for about 30 seconds. Okay. Actually, I'll have you come out of it. That was like a quick practice. We're going to time you.
Okay.
All right. Whenever you're ready.
Mm-hmm.
All right. Good job. All right. Ooh, you all right?
Yeah.
Okay, now you can have a seat. Get comfortable. So now I'm just going to test their cognition. So first, I'm just going to tell you 3 words. I want you to tell me if you can remember them, okay?
Okay.
So the first is basket, lotion, and computer.
Okay. Basket, lotion, computer.
Yep. All right.
Mm-hmm.
So I'm just going to ask you a couple questions.
Okay.
Can you tell me what today is?
Today is Friday the 11th.
Okay. Can you tell me where you're at?
We are at the hospital.
Okay. Yep. Can you tell me what brings you to the hospital?
Pain.
Okay. And
I got pain.
we're gonna help you with that. And then can you tell me who our governor is?
Roy Cooper?
Yep.
Okay.
All right, good. All right, so can you tell me those 3 words I told you a little bit ago?
Basket, lotion, and computer.
Okay. And that concludes our screening.